Congressman for Georgia's 6th District, Vice Chairman of the House Committee on the Budget. Good morning, Tom. Good morning, Congressman.
Good morning, Bill. Wonderful to be back with you.
Great to have you. I got a lot for you, but you think fast and can even be occasionally encouraged to talk fast for a Georgian. So we'll make you do that. First of all, it's interesting, Tom. Just a quick story. Yesterday we had Obamacare Roy on. We were talking about Obamacare and all, and I said it seems to have receded somewhat from the campaign picture. Has it receded in people's lives? We got a storm of emails and phone calls saying, "Not for my life. This is what's happened to me," and premium stories and deductible stories and cancellation policy stories. What's your sense of it? Am I right that it's not front and center in the campaigns, but it's still lingering and very important to people?
I think that's accurate. I think it's not front and center because of the urgency of some other issues that have popped up. ISIS being one of them, and certainly the Ebola challenge, and then just the grind of a campaign. But I've again crisscrossed this country trying to help other House candidates over the past 3 weeks, and right now I'm in Denver, and I hear almost nothing but that. When you talk with people, once you get down below the headlines in the newspapers, it's Obamacare. It's the challenge to employers. It's the challenge to patients. Front page Wall Street Journal today had another article about the penalties for employers and the consequences of that. These narrow networks are huge. People aren't able to see their doctor. And then the story that I'm hearing, and I suspect you are, which is really phenomenal, is that all of these high deductibles for folks, if you're making $40,000, $50,000 and your deductible is $6,000 for your family, you don't have health insurance. And we're seeing that because you're making decisions not to go see your doctor or your caregiver.
We had a caller this morning, an email this morning, from a guy who said exactly that. I think the deductible is $12,000, for a couple. And he said we had these tests that the doctor said we really ought to have, but they would cost X amount. And my wife and I passed. I mean, that's not good. That's not what you want in a system of health care.
Oh, absolutely not. But that was by design, and that's why the administration has these talking points that the cost of health care has come down. But what they're talking about is the cost of health care for government has come down. The problem is the cost of health care for virtually everybody else has gone up, and in some cases skyrocketed, so much so that people are actually denying themselves the care that they need, not because they don't want it, but because the law itself stipulates that more out-of-pocket has to be paid, and they can't afford it.
Roy also said something I'd like to get your opinion about, and I guess John Kasich said something and then had to clarify about the repealing Obamacare and so on. But Ovik said, without repealing Obamacare, which, may be difficult as long as this president's in office anyway, you can still fix it with a lot of free market fixes. You can still have a lot of things you can add to it to change it and to change some of its worst consequences.
Yeah, I think it needs to be repealed. The House has voted multiple times, and I would continue to do so. However, as you say, with this president in office, it's unlikely he's going to sign a repeal of his signature legislation. I think that what we need to concentrate on are those things that the president has actually delayed, one of them being the employer mandate past 2016, and solve that challenge for employers to give the economy a boost, because we need to give employers a much greater certainty. One way to do that would be a very simple piece of legislation that said any health coverage plan that was approved by a state insurance commissioner or state department of insurance would be deemed to meet the requirements of the essential benefits package, in essence opening up once again the insurance market for individuals, so providing choices for patients. That would be a very simple thing to do.
I remember, Tom, I want to be candid here, please, about 10 months ago, maybe December last year, we talked about alternatives. You had just been on the Fox show, I think, in the center seat. And you said how important it was for Republicans to come up to an agreed-on alternative. This hasn't happened yet, has it?
No, and I'm as disappointed as anyone, and I understand that there's some folks on your show who have taken me to task for the statement that I made. And not so much you, not personally. Just why can't the Republicans get their act together? I mean, your name has come up once or twice, but it's been a general, why can't we get our act together? Yeah, well, and I'm asking the same question. What I try to do is give my honest and sincere appraisal of the information that I have. And as you know, and I think I articulated at the time internally within our conference, we came to an agreement as a group that we would come up with an alternative that we would bring to the House floor. And for a variety of reasons that people probably disagree upon as to why it didn't happen, it just didn't happen, which is why I continue to push H.R. 2300, the Empowering Patients First Act, which is a real solution. Sure. Gets folks covered, solves the insurance challenges, saves hundreds of billions of dollars. I'm going to continue to push our leadership at our conference to do so after the first of the year, to come up with that positive alternative, because people need to know that there's a way to solve the health challenges in this country without putting Washington in charge.
Isn't that a much more likely outcome to have an agreed-upon plan if Republicans win the Senate? I mean, more things will be then incumbent upon us, correct?
I think would be remarkably careless of us not to do so with a Republican Senate, because for 2016 to work for the country, that is to get somebody in the White House who's interested in actually solving the challenges that we face, we've got to be able to define the contrast. The only way you define the contrast is to put pieces of legislation that get through Congress, or at least get through the point of support by Republicans, so that they can contrast with the president and his party.
How do you see it, by the way? Do you see us taking the Senate, Republicans taking the Senate?
I'm so much closer to the House, and I think the House we're likely going to pick up 8 to 12 seats, but I think we're going to take the numbers that I look at right now, it looks like it. I'm concerned about my great state of Georgia, but I think in the end we ultimately pull that out. It ought not be as close as it is, but I think it ultimately comes.
Yeah, Nunn-Purdue is a very close race, isn't it?
It is, and remarkably so.
You are a doctor. We have been talking a lot about Ebola. Tell us what you think professionally, with both your hats on.
Well, 3 weeks ago, 4 weeks ago, when all this broke, I had truly great faith in our system that we'd be able to meet any challenge here in the United States, and I still think we can. However, my faith has been weakened a little bit because of what we have seen. Clearly, there were inadequacies in the system, and I think they have been addressed at this point. But I was one who initially said that I didn't think that a travel ban was appropriate, because I thought we could handle what needed to be done. I have since come to the belief that it's important to deny entry to anyone coming from one of the countries that are at the epicenter of the Ebola crisis, for at least a period of 3 weeks quarantine, so that we can make certain that we're not importing Ebola into the United States through the official processes of getting into the United States. Now, that being said, I sometimes chuckle at the conversations that we have, because somebody with Ebola could walk across the southern border and be welcomed by the Border Patrol, so without any temperature being taken or anything. So there are huge holes in our system right now. But at this point, I think we've gotten things hopefully under control. It sounds like all of the patients who are being treated in the United States are improving, and I'm hopeful that we've seen the worst.
We had a nightmare scenario yesterday. Mark Thiessen wrote for the Washington Post. I don't know if you saw it. He said, about Ebola is a weapon. A couple guys go to Liberia, they get infected, they come to the U.S.,
sure.
rub as many doorknobs, sneeze on as many people as they can, blow themselves up in a crowded mall. It could be a disaster. Medically, does that sound right to you in terms of terrorism?
Well, I think the first two would be an attempt. The last would certainly be an act of terrorism, without a doubt. This is a very dangerous world, and that's why it's so distressing to see the lack of leadership that we've seen over and over and over out of this administration. So, another area that I've become concerned about is our ports. When ships come from elsewhere, especially the three nations in question, they arrive at our ports. There's no screening of the individuals going on liberty in the ports of call. So there are huge openings in our system right now that make it much more difficult to control infectious disease. That being said, have the best healthcare system still in the world, and if we follow the kinds of normal infectious disease protocols and containment of infectious diseases, then I don't think that we're looking at a widespread challenge. But look, as I said before, my faith in the system was shaken because of what has happened so far.
I agree with you. Well, that's why we miss you. Come back often. We'll call you again soon. Thank you, Tom Price.
Thanks so much, Bill. Take care. God bless.
Yes, sir. Thank you very much, Tom Price, Congressman for Georgia's 6th. We'll be back. It's your show the rest of the way.